A very common cause of vertigo is a condition called BPPV. So it stands for benign paroxysmal positional vertigo. Basically, that's a lot of words to say that it's vertigo that has no real known cause. It's oftentimes thought to be positional, so based on where your head is positioned, can trigger an episode of vertigo. So oftentimes these cases come out of nowhere. So it can be traumatic in nature, so after a car accident or a hard fall. It can be something that you just kind of wake up with one day. It's terrible. The symptoms feel pretty awful. It makes it hard to move on with your day. But one of the great things is it will go away. These aren't things that you live with forever. The only problem is we don't always know how long that'll take. Some people, it takes just a couple days. Some, it can last a little bit longer. But we're going to talk today about a procedure that we can do here in our office, and that's very gentle, very non-invasive, that can help alleviate those symptoms quickly, safely, so that you can get back to your everyday life. It's commonly believed that your sense of balance actually lives in your inner ear, and that's true. And we're going to talk about why and why the inner ear is such an important factor in cases of vertigo. So you can see right here in this picture, here's the ear, the actual part of the ear that's on the outside of our body. And then you can see the ear canal. The eardrum sits right in this little spot here. And this picture in the center of the book is actually a zoomed in on that inner ear. So like I said, you can see right here is the eardrum. And then on the inside, we have what's called our semicircular canals. And those are these big loopy things in the top here. And these are really important in our sense of balance and basically where our body is in space. And what happens is there's little fluid that lives inside of those canals, and there's crystals, like little calcium deposits that float in that fluid. Now, when you turn your head very quickly to one side, what happens is that fluid will shift and the crystals will move, and it tells your brain, hey, I've moved to the right side. So it's not actually a visual component, so if you close your eyes and you move your head, your brain still knows which way you've turned. And all of that happens from that sensory input at those semicircular canals. So vertigo comes into play is when one of those crystals dislodges in one of those canals, and say you turn your head very quickly to the right, the brain has a delayed response. And so basically it thinks that you're still moving, which is why when you're dealing with vertigo, you can be sitting perfectly still and feel like your body's moving. So a little dip into the science there and kind of how that all comes together. So when we're dealing with BPPV or benign vertigo, oftentimes it's a result of a dislodged crystal in one of these semicircular canals. So we're going to talk about a procedure called Epley's maneuver that we can do here in the office to help settle down those crystals, get them back where they need to be so that the vertigo goes away. With Epley's maneuver, how we perform it actually really matters. So I do recommend that you have somebody who's trained in this procedure perform it on you. So there's a lot of DIY videos out on YouTube, and I'll be honest, they don't really work at the same level of effectiveness because the precision matters. You'll see when we go through the actual procedure, there's certain positions that we'll drop the head into and move the body a little bit with, and all of that is designed to mimic the angles and patterns of the semicircular canals where those crystals live. And so if we do it wrong, you're not really going to have any relief. And so our goal is to give you that relief as quickly and as safely as possible. Trust me, just come in, we'll take care of it for you, or go somewhere where your provider is trained and comfortable performing the Epley's maneuver. We're going to show you what Epley's maneuver looks like.
Before getting started, it's important to keep your eyes open throughout the entire procedure, your eyes still without wandering, and to relax your head so that the provider can move your head through the motions that are needed. Now to start off, the provider is going to start by turning your head, and she's going to ask you to come down on your side, and it's important to notice that you're going to come down without extending your elbow. You want to make sure that you're coming down on your side flat. For this next step, you're going to be lying flat on your back, and as you're running through that movement, you're only twisting your body. You'll notice that her head is staying in the same position as it's being controlled by the doctor. Now this next portion is going to last about 30 to 45 seconds in reality. For video purposes it is sped up, but just be mindful that it will take a little bit longer. Now for this next portion, the provider is going to ask you to lie on your side. So you're going to twist your body to the opposite side in which you started on. Next, she's going to ask you to quickly sit up, and if you need any assistance with getting up, there will be another person in the room to help. At this point, it's not uncommon to feel nauseous or dizzy, but we'll be there to help you through it.
Keep in mind that it may take more than one maneuver to resolve your vertigo symptoms. So depending on how long the vertigo has been present, how severe it is, and a lot of other factors that we'll talk about more one-on-one, it may take a few tries to get things right. But the good thing is these things usually resolve within a week or two with the proper treatment. Also, do keep in mind that when we do the procedure, sometimes the vertigo will get a little bit worse, but it will resolve here pretty quickly within a few minutes after doing the procedure itself. So because of this, we do recommend that at least for the first time, you do have somebody with you to drive you home, or plan to hang out in the office for a few minutes to kind of gain your composure before you go on drive. Also, some people do get pretty nauseous with the maneuver. We are right there with you, so we promise if you get sick, we'll be there to help. But it is pretty rare, so you may feel that sensation that you may need to vomit, but I promise it's not all that common. So remember, like I said, there are a lot of DIY videos on YouTube, but we do recommend that you keep this one for something that we perform in the office with a trained professional, and don't try it at home because you can actually make your vertigo worse and get yourself into a position that's very uncomfortable. So we don't recommend doing this at home. We're happy to help. If you have any other questions or concerns, just let us know.